How does sputum smear microscopy diagnose TB? Imagine catching a tiny sign of tuberculosis right from your lungs. That's what sputum smear microscopy does. It looks for special bacteria called acid-fast bacilli in the mucus you cough up. When someone has active tuberculosis in their lungs, these bacteria are present in the sputum. The process starts with collecting a sample of this mucus, ideally on 2 or 3 different days to increase accuracy. The sample is then spread thinly on a glass slide. Next, a special dye, like Ziehl-Neelsen stain, is applied. This dye sticks to the bacteria because of their waxy cell wall, which makes them resistant to acid washing. After staining, the slide is examined under a microscope by trained technicians. If they see the bacteria, it confirms the presence of tuberculosis bacteria in the lungs. This means the person has active pulmonary tuberculosis. Sputum smear microscopy is quick, inexpensive, and widely used especially in countries where tuberculosis is common. It is very specific, so a positive result strongly suggests active TB. However, its sensitivity depends on how many bacteria are in the sputum. It usually detects TB when there are at least 5,000 to 10,000 bacteria per milliliter of sputum. This means it might miss early cases or those with low bacterial loads, such as in people with HIV, children, or cases of extrapulmonary tuberculosis. To improve detection, health workers often collect multiple samples over consecutive days. The number of bacteria seen in the smear can also give clues about how infectious the person might be. Despite some limitations, sputum smear microscopy remains a vital tool in diagnosing TB because it is accessible and fast. It helps identify the most infectious patients quickly, which is crucial for controlling the spread of the disease. If the smear is negative but doctors still suspect tuberculosis, they may order additional tests like culture or molecular tests, such as the expert MTB-RIF assay. These tests can detect TB bacteria even when bacterial numbers are low. Proper collection of sputum is essential for accurate results, and in some cases, procedures like sputum induction or bronchoscopy are used to obtain samples safely. In summary, sputum smear microscopy diagnoses tuberculosis by visually confirming the bacteria in mucus samples through acid-fast staining and microscopy. It is a cornerstone of TB diagnosis worldwide, especially in resource-limited settings, because it provides a rapid, cost-effective way to identify infectious cases and help start treatment promptly. Always remember, if you or someone you know is being tested for TB, consulting healthcare professionals for personalized advice and further testing is essential for accurate diagnosis and care.